When I joined the program, I think it was a really interesting time for where the program was. They had had some intern leadership in place, and I think they were just ready for a fresh set of eyes and a new perspective. And so they called me their baby boss. You know, maybe being younger, being willing to challenge the status quo, being willing to step outside the box, willing to ask the question of, well, we've done it that way for 30 years, do you think maybe we could try it a bit differently? So I think really, again, I was just a catalyst. I got to come in with enthusiasm and sort of push the envelope and try things that perhaps the team had been scared to try before or hadn't even thought of it before. And I certainly didn't bring the ideas. It was a collective approach to the ideas.
We had a vision of maternity unit before Jennifer got here, and we couldn't have chosen a better person to actually make that vision a reality. And I think that she really has dramatically improved the work environment for all of us on the maternity unit.
Jen is a phenomenal leader, and in the 3 years that she's been here, there have been major transformations that I've observed.
Hey Mary, how's your day going?
She is very enthusiastic and very charismatic. She has an open door policy, and I think what is most unique about Jen is her ability of that face-to-face time with each person. She is a visible presence on our unit, not just for the nursing staff, but for our interdisciplinary team members. She's interested in what people are doing at work and what people are doing outside of work. She's very much a role model in being enthusiastic and loving and passionate about the care that we provide to our patients and their families.
Yeah.
She's developed a group of leaders, the CNL, the CNS, that are also available to the nurses. And I think that that has changed the whole feel of nursing within the unit. She's empowered them to be equal part of the team with the physicians and the midwives. And we have a lot of young nurses, and she's really helped them to grow into that sort of a position.
She is enthusiastic and passionate when she comes in every day. Her phrase is that she's living the dream, and we hear that lots of times during the day. And just her willingness to see what's not working, face it head on, and really advocate for not just the nurses here, but the interdisciplinary team, to whether that's doing a lean redesign, whether that's to advocate for new roles such as my role. But she advocates for this unit and advocates for the patients and the families.
It's pretty easy for me to be inspired and to be engaged as a leader when you've got people that have worked here for 30 years that all they want is to provide excellent care to their patients. Like, you can't ask for more in leadership than people that complain because they couldn't provide great care to their patient. I mean, how can you argue with that as a leader?